It is a pleasure to have Mike Chapman with us today. Mike is a frequent public speaker on the subject, and he's a subject matter expert when it comes to healthcare and insurance matters. He is a licensed insurance broker, and he has literally helped thousands of individuals and businesses in Texas, including myself, with their insurance options and providing no obligation, no cost insurance consultations, as painless as it can be, enrollment and ongoing support for his clients. So Mike represents all available options in North Texas for health insurance for individuals under the age of 65, and most options for individuals over 65, and most options for all businesses of all sizes. So it's a pleasure to have Mike with us today. So Mike, I'm just going to turn it over to you.
Thank you very much.
We appreciate
first
your
of all,
time
just a
this morning.
sound check. Can everybody hear me? Okay, now I'm going to have to fumble through to get so you can see my screen.
Yeah, it depends whether your menu bar is at the top or the bottom of your screen, but if you just, just so run your cursor up to the top and the menu should drop down, and you should have an option that says
slide
share
by
screen.
slide mode, request remote control.
I've already given you,
Yes.
Now did you sign into the link that I sent you?
Oh, okay, there we go. I got it.
Bottom and hover over there, and a share screen will pop up.
Yeah.
All right, so let me find my, can everybody see that? Okay, welcome. I look forward to talking with everybody and answering questions. This is my time of year to really get out in the public, which I enjoy doing, and to reconnect with old friends, make new friends. I've been doing this for, since 2000, since the recession of 2001 aftermath. About 100 years. Somewhere
about
along
100
the line,
years, 150.
I met that Foster guy and Clayton guy and a number of other people, and it really makes my heart glad to see old friends and make new acquaintances. Okay, so what do you think of 2020 so far?
So much for 2020 vision, that's for sure.
Okay.
No doubt. I like that, Clayton.
Well, what a year.
To keep it clean, nobody can answer.
I mean, who would have thought? Even forget the pandemic. We got murder hornets. We got locust plagues all over Africa. We have air you can hardly breathe on the left coast. We have hurricanes like every other day. And there's this thing called a recession. And for many people, this is the first time that you have had other insurance other than employer coverage, and it's a lot different. And so this is an opportunity to learn, ask questions, because it's a different matter. And this is just a little bit of what's been going on. It's been a heck of a year. We know how important healthcare is. You get reminded constantly of the importance of things like isolation and staying safe and healthcare shortages, distancing, and we're all kind of turning into hermit crabs this year because there's a lot of stress. But the purpose of this meeting is to talk about what do you do about it personally. Never since 1917 have we had such a devastating healthcare crisis that has led to an employment crisis. And believe it or not, folks, this has all happened in just about 6 months, just really over 6 months. I don't ever recall a time when the world has changed so quickly. What will 2021 look like? Is it going to be a return to normalcy, or is this our new normal? We don't know. And a lot of what I'm going to talk about today is subject to change. I'm going to base this on the rules and regulations that exist today, the existing plans and the different programs. But as you know, this year, that have been a number of exceptions and relaxation of guidelines, which may or may not occur. And it's like anything else. You have to just every time you turn around, things change. We should be hopeful, but we just don't know. I'm always hopeful. Okay, a little bit about me. I've been doing this for a number of years. I help people with medical insurance, Medicare related stuff, lifelong disability. I really study federal, state guidelines and regulations, which are constantly changing, especially in an election year. A lot of pontification from people that don't have to live with the consequences of legislation as far as healthcare and insurance goes. Uh, I also can advise on Social Security. I've been a licensed broker pretty close to 20 years. A 5-minute phone call with me is all it can take people from making a bad decision, or worse yet, not making the decision, and then getting stuck with no coverage. And then in a pandemic, that's not such a good idea. I know I frequently talk every week, it seems like, with multiple people that spend hours and hours shopping on their own and studying and all this stuff. But really, a 5-minute phone call, I can do that homework for you. That's what I do at night when I'm watching Netflix. Is I'm doing homework for clients, and I guess my life's kind of sad, huh? But this is a no-cost advice from an insurance expert. There's no cost for it. A lot of people want to play email tag with me, and ask questions. I don't have time for that this time of year. 90% of my business occurs between October 15th and December 15th. So phone call or text. I'm also going to talk later about live streaming, where I'll be accessible. I want to help as many people as possible, but if within 5 minutes I can get the information I need, give you some basics, and make some suggestions, and then do the homework follow-up afterwards, and then we can talk. I readily share my information and advice. There's going to be a ton of changes, not only depending upon what happens in Austin or what happens in Washington, D.C., but also what happens around the world. Okay, we just don't know when. Is there going to be a vaccine? How effective it is? What's it going to cost, if anything? A lot of uncertainties. Every year between about August and last week, I put in about 500 hours in my back cave. I recertify, I retrain, and this is all for the benefit of this basically 2-month period from October 15th to 12/15. I just crawled out of my back cave last week, and I'm really looking forward to doing this during open enrollment. Let's see what. Okay, pandemic 2021, employer-based health insurance. There's something like 27 million people that have been furloughed or termed or whatever that had employer-based health insurance in the U.S. that do not now, and that's awful. Employer-based. It's always better when your employer subsidizes it, pays 50% of it. But there's some things that have changed. Employers are realizing that remote work isn't so bad. You don't have to pay expensive office space. Business travel will probably lag because we've all become Zoom junkies. And certain regions like travel, hospitality, retail, other sectors are going to lag behind others. And others, we're fortunate in North Texas, we're in one of the better locations in the country as far as job growth goes and job opportunities. One thing that happens, and I know this personally in my 40s, after 2001, when the Twin Towers came crumbling down, and the invasion of Kuwait and Iraq, there is during a time of an extended recession, there is an age discrimination. And what happens oftentimes for people in their 50s and 60s, and even I know a lot of people in the 70s that are working, that you have a de facto early retirement because you're the last person hired. Now, that doesn't mean that that's always the case. If you have the chops and the job skills, there are exceptions to that. And there's things you can do. You can start your own business like I did. You can buy a franchise. You can do 1099 work, which is going to be more prevalent. But my point is that you need to look outside the box, not only for opportunities in employment, but also for healthcare. And it's not just cost. It's for many people, they're used to the employer making the decisions for you as to what plans and options are, plan A or plan B. Here's what it costs, comes out of your paycheck every 2 weeks, or you know what I'm saying. The mental and emotional stress impact of this pandemic-related recession cannot, cannot be cannot be overlooked. It's huge. Uh, just like 4 years ago, and 4 years ago before that, and every 4 years prior, healthcare seems to be the thing that gets kicked around and tossed around. And I've got some opinions on that. I think the legislative and executive branches in Austin and in Washington, D.C. should eat their own dog food and be part of the same coverage that individuals and self-employed people and people on COBRA are. That's unlikely to happen. Health insurance return, um, you're going to find telehealth and also retail primary care taken over. It is going to be more and more likely that you will be going to a Walmart or a Walgreens or CVS for primary care in the future. And that's not necessarily a bad thing. That's one of the ways that that the forces of disruption are going to reduce the cost of healthcare. And forget about insurance for a second. Insurance is the mechanism for spreading risk of having to pay for medical claims. But healthcare in this country is insanely expensive. One of the things that is going to happen over the next few years is disruption, and I welcome it. We spend way too much money as a country. We have some excellent first line workers, but it's very costly. I think everybody would agree to that. We're living in very interesting. I don't ever recall a time that there's been so much change in such a short period of time. Now, for many of you, I'm going to go through a couple of basics for you because this may be the first time this fall that you've actually had to choose what to do, and I'm going to go through a few concepts. First of all, insurance is not healthcare. Insurance is a mechanism for spreading and sharing the risk of medical expenses, and just especially this year in a pandemic, even if you're perfectly fit and healthy and have never seen the inside of a doctor office, I can tell you personally how quickly that can change in just a moment, whether it's from a pandemic or something else. Taking care of your health, but being smart about it in a cost-effective manner is something you can spend hours trying to do. I'm talking, you can take weeks, but man, I've spent 500 hours a year just recertifying for what 90% of it I already know. Number two, there's types of insurance. First of all, who's the largest source of insurance in the country? Uncle Sam and Austin. Okay, and every state has, and you go further down, school systems, et cetera, et cetera. Beyond that, you have employer insurance. Number two, as I mentioned, 27 million former employees are now in the country are now looking for insurance options. And then with individuals for insurance, you may have been termed, but you're approaching Medicare age. And that's a whole different ball of wax. There's limitations to what I can say in a webinar. I am able to ask any questions, but the minute I go into either an educational setting or talking about plan specifics, then I'm non-compliant. But I'm able to and willing to answer any questions that come up. So please, if not today, during Mondays from 5 to 6, I'll be live streaming where you can ask me anything you want. You can do it anonymously. I have things I'll talk about, but it's primarily an opportunity to respond to you. It's the most highly regulated industry in the country, even more so than financial services. They have their regulation burdens, believe me, but now you factor in health and what's called medical underwriting, and you have more risk. The more risk there is, going from state, federal government, to employer to individual. If you're an individual of one, you could be as healthy as a horse, but you have more risk than a company of 1,000 employees, you know what I mean, or a state or federal government. So the smaller the number of people, the more you're going to pay because you're covering risk. Also, the older you are, the actuarial tables will tell you that you're going to pay more than your kids, or half your age. Then under 65, there's different rules and different costs. Actually, over 65, there's a great deal. I mean, until for right now, coverage under Medicare is pretty awesome. Okay, individual insurance premiums. Now, employer has to subsidize the employee-only health insurance premium by at least 50% and often more. That's why when you see your COBRA, what COBRA costs, you say, holy cow, that's expensive. Why is it so expensive? It's because the employer pays for half of it. Individual insurance premiums, depending upon what you're looking at, may also be subsidized by Uncle Sam based on your household income and your household size. I'll get into that in a minute. The other important factor, insurance coverage for pre-existing conditions. No problem with employer-based or COBRA or government insurance. There's coverage for any and all pre-existing conditions, part of the Affordable Care Act plans. For individuals who are looking for insurance in Texas, for Texas residents, plans through the Affordable Care Act are regulated by the Affordable Care Act. In Texas, we purchase those through healthcare.gov. You may or may not be eligible for a premium tax credit, but it's going to cover all pre-existing conditions. Now, why does that matter? I'll talk about that in a second. Timeline for insurance. Let me talk about timelines. Government insurance, Medicare specifically. Most companies and even the government, FEHB, has federal government employee health benefits, have end-of-year open enrollment for 2021. In Medicare, the open enrollment begins October 15th. Unless you're turning 65, you have an initial enrollment period that begins 3 months before your 65th birthday. Medicare, though, you can make changes to your plans October 15th through December 7th. Employer-based health insurance, you have a COBRA opportunity to enroll within 60 days of loss of coverage. That was extended through the pandemic to when there was a federal emergency. That's often extended, like in Florida, whenever there's a hurricane, which this year seems to be every time you blink, there's another hurricane, apparently through Florida or Louisiana or Mississippi. But otherwise, it's 60 days from loss of coverage. Plans through the Affordable Care Act, you can enroll beginning November 1st through December 15th. Open enrollment for coverage beginning January 1st. It is a shotgun start. Nobody sees what the plan, I know a little bit about the plan changes, but nobody knows what the rates are or what the subsidies will be until November 1st. And usually I need to do a couple of days of research the first couple of days of November to know what stuff costs and the relative value of different companies. Other than that, you have a special enrollment period, and that's usually as a result of job loss, death, divorce, birth of a child, moving from one state to another, that type of thing. That's a special enrollment period outside of these open enrollment periods. Generally, there is no open enrollment period for plans that do not cover pre-existing conditions. Okay, and I'm going to talk a little next about why you'd want to consider a plan with that does not cover pre-existing conditions. What is a pre-existing condition? First, it's anytime you've had a prescription filled, you have taken a medication for something that would be underwritten. Okay, I have had seasonal allergies. When the cedar pollen blows from West Texas, I'm in agony. I just stay indoors and of course this year we're all in masks, so maybe it won't be so bad. But pre-existing conditions are only important from a coverage and from a cost standpoint if you have something that is serious, potentially life-threatening, chronic, or expensive, like allergies. Okay, I take a Zyrtec every morning. I may take 2 if the cedar pollen is blowing, just to keep it under control. What you want to consider, though, is I have a typical Ozzie and Harriet family here of 4. Let's say you, Mr. Husband, or you, Mrs. Spouse, or you, Mr. Individual, or one of your kids has a serious, expensive, chronic, or potentially life-threatening pre-existing condition. Well, that person should consider COBRA. If COBRA is not on the table or an option, then until there's coverage through the next employer, the best option would be a plan through the Affordable Care Act. But unlike what you've had to do during open enrollment through an employer, you just sign up the whole family, it comes out of your paycheck, et cetera. You don't even think about it. Just check the box and skip out on the open enrollment meeting and sign everybody up for the same plan. When you're looking at individual insurance, you may not want to do that. In fact, I recommend you what I like to refer to as unbundle your family's health insurance. The reason being is that the people it may be you only, or it may be you and your spouse are perfectly healthy, or you and one child, or all your children have no expensive, chronic, or life-threatening pre-existing conditions. Well, there may be great coverage options for those individuals, but the individual that has a potentially life-threatening or chronic or expensive condition should remain on COBRA or a plan through the Affordable Care Act. A couple of other things that impact your decisions, in addition to your health and the health of your family unit, whether that's you or you and your spouse, or you and one child, or all children, is people's age. As you get older, as I mentioned, there's more risk, there's more cost. Can be a lot of cost the closer you get to 65. The other thing is income, both your estimate and I'm talking about what you imagine here in this crazy year, this pandemic year, with the recession, trying to figure out what your 2020 household modified adjusted gross income is. That just, that makes my head hurt just thinking of putting myself in your shoes. But I do that. I can help you determine what that is, because you may qualify for a premium tax credit, otherwise known as a subsidy, for a plan through the Affordable Care Act that might make that the best option for your whole family. Also, the longer the job time horizon, if you've got some irons in the fire and it's just a matter of whether employer A or B will give you an offer in the next 3 months and you feel pretty good about it, then that's less risk than if you're pretty sure that you're going out on your own as a self-employed person or a 1099 person. And that may be the future for 2021 and beyond. That's a longer time horizon, and the longer the time horizon, the more the risk. Okay, so these are some of the factors that should be influencing your decisions. Okay, now here's a lot of type. I'm sorry about this, but this, this is IRS stuff and the federal government, so it's a lot to swallow. There's this thing called MAGI. Magi is what some people pronounce it, not to be confused with Magi, but modified adjusted gross income. I won't bore you with the CPA definition, but it is what the IRS uses to establish if you are qualified for premium tax credits and cost sharing. And that can significantly reduce the cost of not only your insurance premium, but also your out-of-pocket expenses. If your children work, they could be working at McDonald's or anywhere else, then their income counts too. So it's your whole household. Now, there may be cases where it actually is better for you financially not to take the standard deduction for one of your children, because if their income, let's say you have a child that's age 24 and is making some decent money, that can push you out of being eligible for as much of a premium tax credit that could be worth a lot more than that annual deduction for that person. Hopefully that made sense. If not, I can clarify that later. All right, here's a chart. I want to study this for a second. And can you see my cursor here? Okay, let's see.
Yes.
This is household size. This is and this is 2020. We're sitting here about ready for open enrollment, and the government hasn't announced what it'll be for 2021, which I don't understand. But less than this 100% of federal poverty levels, there is no premium tax credit in Texas. The reason being, Texas did not expand Medicaid for adults. So unless you're pregnant, unless you are a child under the age of 19, or unless you're over 65 and low income and also low assets, then you're not eligible for premium tax credit or for Medicaid. So in Texas, below this amount, just think about your household size, whether it's you and your spouse, kids, etc. Below this amount, there's no premium tax credit. Now, here's an important number here, okay? Right between here, actually right here, you're also eligible for what's called cost sharing. And that's where your deductible, your co-insurance, and your premiums are brought down as well. So, if you're between 100 and 138%, you're in the sweet spot that if you purchase a silver plan only through healthcare.gov, you are eligible for not only a very significant premium tax credit, and that tax credit will be indexed not only on your income but also the ages of people that are applying. So if you're in your 60s, it may be the best option for you because other options are going to look pretty expensive. But right in 138 or less, silver plan, cost sharing. As you go to the right, there's my cursor. As you go to the right, and income, and again, this is 2021. It doesn't matter what happened in 2020. So you may have been furloughed halfway through the year, but you made a lot of money this year. Well, it doesn't matter. What matters is what you estimate for 2021, and that is incredibly hard when you're in a job search mode during a pandemic. I realize this, but this is the rules. I'm just trying to help you understand the rules. The more you go to the right, the less of a premium tax credit there is. And that means there may be better options for people that are not don't have serious life-threatening, chronic, or potentially expensive conditions. Okay. Any questions? All right, I'll move on. I can answer questions later. All right, busy slide chart, but this was from a webinar. I record a lot of webinars and then watch them at 2x or 3x speed just to stay up on things. This is a snapshot from one. There are, I don't know, something like 67 million Texans. According to the last census, we'll find out there'll be a lot more from people from the left coast and the right coast moving here. But out of that, there are 1.3 million Texans last year with coverage through ACA, Affordable Care Act, through healthcare.gov. 2/3 of those are on exchange, which means their income, excuse me, is between 100 to 250% of the federal poverty level. Of those that are off exchange, meaning they're making too much money to qualify for a premium tax credit, that represents not a lot. A third of 1.3 million in a populous state of 67 million people, I guess, closer to 70 by now. That doesn't mean that that's not important. And the research backs this up, that the people that are in this, that are on plans through the Affordable Care Act, they need coverage for pre-existing conditions. Okay. So again, remember this strategy of unbundling your health insurance, looking at options based on your income, the health of your family members, and this is what I can do. So 5-minute phone call, we'll talk about this. I'll throw out some options that I can send specific recommendations to you. Another head hurting. I'm sorry for all the type. I know this is, especially in a Zoom meeting, is pretty tough, but there's some things that I wanted to cover because there's so many people that for the first time are not on an employer health plan. Here's the CPA's definition of modified adjusted gross income. And again, it's 2021. See? All of your income, 1099 and W-2, can include rental income, dividends, and short-term gains. I've got this in red, and I'm going to bring that back up in a second. Social Security income, but not if you're on Social Security disability income counts. Unemployment income. This won't be in effect for 2021 unless there's another round of PPP in 2021, but that would count. PPP loans and expenses do not count for modified adjusted gross income if you own a business or are self-employed and qualified for some of those. But the consequences of forgivable loans have yet to be determined by the IRS whether that counts. Any new stimulus funds will reduce premium tax credits and cost sharing. Now, let me go back to this for a second. Let's say I'm going to go back to this slide. Pardon me, don't get dizzy here. Okay, here we go. Let's say you estimate you're not going to make income because you've run through unemployment. You're somewhere in this range where you'd be eligible for cost sharing, but you're not making enough money to get to this level, or what you estimate. Well, believe it or not, you can withdraw money from a retirement account, and if your income is very low, the federal tax, since we're in Texas, the great state of Texas, without a state income tax, the federal tax on that, you might be in a 10 or 15% tax credit. So if you need, let's say you need $3,000 to get to the minimum amount for a premium tax credit, withdraw from retirement accounts, you'll pay the penalty. Okay, what is it, a 20% penalty? for withdrawals. You pay income tax on that, but you only pay the penalty if you're younger than 62 and a half. But in any regards, the tax on that is relatively low, but that can save you several $1,000s. I mean, if you're in your 50s or 60s, couple, that'll save you just doing that and being eligible for a premium tax credit. I mean, that could reduce the cost of your insurance like you wouldn't believe, and you qualify for cost sharing. So that, I can go through that with you. Give me a call. We'll talk about it. Now, who's not eligible for premium tax credits? If either spouse has access to a group health plan, no dice, no tax credit. So if you've been laid off, but your spouse is working, you're not eligible for premium tax credit. You might somehow slip through the cracks, but then at some point you're going to have to pay your, any tax credit back to Uncle Sam. And then if you haven't paid your taxes for the previous year, you're not eligible either. Now, in Texas, you will not be eligible for a tax credit if your household income is too low or more than 400% of whatever the 2021 federal poverty level guidelines are when they're announced. Now, cost sharing, I didn't give you an example, but if you select a silver plan, again, bronze or gold won't help you, but if you select a silver plan, cost sharing will significantly reduce your copays, your deductibles, your out-of-pocket expenses, and that probably will make the decision of what type of coverage very easy compared to the cost and the quality of coverage with other options. However, plans through the Affordable Care Act, let me say this about them. They do cover pre-existing conditions, but you do have to use the doctors that are in the network. In Texas, as in most states, there are no PPO plans. What does that mean? That means it is a managed care plan, and you probably have not been on a managed care plan. They're not bad plans, okay? What it means is you have to be in the network of the doctors that are in the plan. If you go out of network, not only outside of the doctors that are in the network, but outside of the geographical area of that network, then you are out of network, meaning you're out of luck, because if you have a major expense or major claim, you're going to pay according to your ability to pay. And that's where you end up. Where you end up in trouble. So, unlike your employer plan, where PPO plan, okay, my doctor's in the network, I have to pay more, but at least I can submit the claim. You're on your own with plans through the Affordable Care Act. There are two types of plans that are available: HMO plans, Blue Cross Blue Shield, and Molina, another company. There are gatekeepers. What is a gatekeeper? A gatekeeper means your primary care physician who is in network has to make a referral to an in-network specialist who is in network. You can't just pick up the phone and call a specialist and expect to have your insurance covered. What are the non-HMO plans? There are EPO plans, exclusive provider organizations. With these plans, you can pick up the phone and you can call a specialist who is in network and have coverage. However, and it doesn't mean it's not a bad idea to have a primary care physician give you the benefit of their network and expertise to recommend a specialist for you, but it's not required. And if you got something life-threatening or severe, that can make a difference. It makes a difference for about 5 or 10% of the people I talk to who want to have their, they say, absolutely have to have my doctor. Well, nothing is good except by comparison. That's one of those things that my dad drilled into my head growing up. Nothing is good except by comparison. It may not be what you want, but it's the best that you can do. And according to all of the different options, I'll help you determine which is the best option for your particular situation. No two persons, even in the same family, have the same situation. You may have a different risk tolerance. You may have different budget. You may have different health conditions. No two people are alike. Okay, however, the Affordable Care Act plan, believe it or not, this is boy, 8-9 years now on the Affordable Care Act plans. The medical community has pretty much come to the realization that they need to get on the bandwagon. Okay, so doctors, and I'm seeing this a lot, doctors that shunned the Affordable Care Act a few years ago are suddenly signing up, not suddenly, but slowly signing up for networks and contracting with networks for these plans. And then it's a matter of finding which of the 5 or 6 different companies are going to be your doctors may or may not be in network. It'll take you hours that would be better served in a job search than trying to do this on your own. But I do a lot of this stuff in my sleep, so it's not that bad. More competition, which is really good. There's a company called Ambetter, which is the name brand of the largest health insurance in the U.S. that you've never heard of, by the name of Centene. The largest health insurance company in the U.S., and you've never heard of it, Centene. They insure 1 out of 5 individuals in this country for insurance today, either through group or individual Medicaid or Medicare plans. They're coming to Denton and Tarrant County. They have an EPO network. There's this company out of Colorado called Friday Health Plans. They're coming to Dallas, Collin, and Tarrant County. Okay, nice folks. Very nice plan design and simple. They have like 5 or 6 plans, straightforward. I'll talk a little bit about them. I have no idea how they're going to compare from a network or the cost of those plans compared to their competition, because like everybody else, I see them on November 1st, so I'll be studying that. You're going to see more HSA eligible health insurance plans, which have been absent for about 5 years. What does that mean? If you haven't had one, it's a great way to, and you're either really healthy, or if you're not really healthy, it's a great way to set up with the right type of plan, the plan that does not have copays, if you will, for doctor visits or or medications that aren't preventative. Then you want to ask, is it HSA eligible? Those type of plans, you can then set up a health savings account with just about any financial institution. You can take you can make a tax-deductible, actually tax-free contribution into what's called a health savings account through the financial institution, and use that to pay for your out-of-pocket medical expenses. If you don't use it in 2021, it will roll over to the next year. The next year, you can use it in retirement when you're 80 years old. It continues to grow tax-free. Good deal. There already is this year, and this is going to be the again, more stress on primary care physicians, more use of telemedicine, which are not only by maybe your doctor is doing teleconsultation now. There's also telemental health, which has become very important in the hermit crab year that we're in, because of all the stress and all the emotional issues. And so you're going to see that built into the plans as opposed to being exceptions. More doctor visits with copays on many plans. In the past, many of the plans would have limitations. 1 or 2 doctor visits would be it. And after that, everything you spend, you get the network negotiated rate, and it would go towards meeting your ungodly high deductible. But many people have not, 2 things that happen. Insurance companies are trying to be more competitive, but the other thing is that people have been afraid to go to the doctor, so they're not seeing the doctors often. I will tell you there's also more confusion. Blue Cross Blue Shield, it will be offering plans with 3 different networks. So if you're just shopping on price, I tell you what, I talked to a lot of people that end up shopping on price and they end up in the wrong network and regret it. Expanded use of generic formularies. Look between the lines to make sure if you're on some medications that the drugs that you are that are needed to keep you going are in the formulary. And then, like I talked about, know the difference between an HMO and an EPO plan and network, and check to see if your doctors are in network. I mentioned Friday. That's FriDav, but it's actually Friday. It just got cut off. Here's some features of their plans. This is the company in Colorado I mentioned. Unlimited primary care visits, $0 annual wellness exam, unlimited mental health visits, $0 generic drugs, zero for telemedicine, teledoc, and urgent care, $75. Okay, here's Blue Cross. They're proliferating. They're the great proliferator of and confuser, and in my opinion, expert and experienced opinion, the company with the worst member and broker services, customer service, but they're Big Blue. Okay, so they are the only company that's available in every state. They are going to confuse the heck out of people who will buy on price unless they know otherwise by offering plans with 3 different networks with 3 different costs. And they have this arrangement with a company called Sanitas, Sanitas, that have kind of like urgent care walk-in clinics, and that becomes your primary health provider. Might be fine for your kids who are young and healthy, but if you've got chronic conditions and you need to see a specialist, probably not such a good idea. Okay, some changes with Blue Cross Blue Shield. They've removed the primary care office copay visit, primarily because of competition, which is great. 0 in-network deductible on 94% of cost sharing. Okay, again, these are subsidized plans who are for people that are eligible for a cost sharing reduction on 2 plans, and some additional changes here. Okay, now deductibles. You can, and this isn't just Blue Cross Blue Shield. You can see deductibles are going up by about, for most plans, they're going up from, again, this is a family, you're going up from, you can see the numbers here. You can see the deductibles are kind of scary. They're in the nosebleed section, which means if you have something that requires going to the hospital, imaging, MRI, surgery, outpatient surgery, anything other than doctor visits, you're going to pay the network negotiated rate, and that will go towards your deductible and coinsurance until you reach your maximum in-network out-of-pocket maximum. And again, remember that there is no coverage for out-of-network, so important. What's new in Texas with ACA plans? Because this is $89.50, that should be $85.50. That's the new normal. Okay, it's pretty high. They're also going to find some higher deductibles with most Medicare Advantage plans, and employers have to increase deductibles to keep the costs in line. But here's I say newish because there's more options here. And this is something I like to refer to as insure your insurance. You can cover part or all of the risk of major out-of-pocket expenses, the high deductible coinsurance out-of-pocket expense risk, or having to go out of network. If you get in a car wreck outside of Texas and you're in the Blue Cross Blue Shield network, you're out of network. And if you're admitted to, you'll have emergency coverage, okay. But other than that, you're on your, and that emergency coverage would not get the network discount. You're going to pay a lot of money. So one of the things you can do to reduce that risk is to get some much lower cost supplemental coverage, kind of like individual AFLAC, if you will, accident only or accident and critical illness coverage, or hospital and or outpatient surgery insurance, and there's other option I'll talk about during the live streaming. That's actually it's like a debit card where you're given an allowance that will give you so much money, and it's based on what the government reimburses employers or reimburses people, reimburses providers for Medicare. So it's indexed off of Medicare, but that doesn't mean your doctor has to accept it, but it's a way of covering some of this additional risk at low cost. Okay, so you may have one or more students in college, student plans, student health plans. If they're full-time college students, which generally means 12 plus hours per semester, they're likely to be eligible for a student health plan. And those are usually, if it's available, the best option for student health plans. So if you have a child that's heading to college or is already in college, hopefully at Ohio State, right, Foster, that they will go to, you look at covering them through student health plan. Now, short-term health insurance plans are just what they said, what they're called. These may be less expensive than COBRA, and they may be lower cost than if you don't qualify for a premium tax credit. But they do not cover pre-existing conditions. But it's a way of getting some coverage. You could get a short-term health plan coverage beginning at 12:01 a.m. tonight if you complete an application today. If you have medical conditions, they won't cover those, but they'll cover you for everything else. They also don't have wellness exams. This is a way of covering you until year end. You don't want to go into the year with a short-term health plan. The reason being that once that plan expires, if you have an accident or illness while you're on that short-term health plan and you're not in an open enrollment period, you're out of luck. You got to move out of state or something to get. Well, even that won't work because you have to have an out-of-state special enrollment plan. You have to have coverage now, so that won't work. Okay, Christian healthcare sharing ministry programs. I was on one of these for 4.5 years. They're not insurance, but they manage and reduce risks. Those who qualify, individuals and families to age 65 who are Christian or live a Christian lifestyle, very affordable, especially for families and people that are in their 50s and 60s versus some of the other options, unless you're in that federal poverty level, eligible for a cost sharing and a subsidy. If you're healthy, like I'm talking low body mass index, etc., you may be eligible for a 20% discount, but you may pay more if your BMI is high or you have other conditions. You're not eligible if you smoke, abuse alcohol, tobacco, if you have out of wedlock maternity, or if you're involved in a DUI, you're not covered, or you're not eligible. There's no coverage for pre-existing conditions for years, but you won't be denied coverage. So again, it's if you have something that is not life-threatening, is not, it is manageable, it's not expensive, then this is a good option. Some of these programs are excellent, some are horrible. Some you have to wait to get a check in the mail from another member before you get reimbursed. Many of them, it works better than insurance. And the best one offers, and one other one offers a nationwide PPO network where you get the benefit of the network negotiated rates. And there's nothing like that through the Affordable Care Act. I'm not permitted to talk about specifics on those in a public setting, but I'd be happy to talk to you individually. Small group health insurance plans. Now, some of you.
Mike, would this be a
little
decent
bio
time to take a
break would be
break in
good.
case someone needs to do a bio break or get a muffin
Sure.
to help them
And by the way,
this,
I'm recording
the
this too, so I can send you the recording if anybody.
All right,
All right.
that'd be great. All right, well, let's go ahead and take about a 10-minute break. I have 10 o'clock. Let's go ahead and be back here at 10 after.
Okay.
and we'll resume our
We talked
conversation.
about Christian healthcare sharing ministry programs. They are a great option if you're like 61. You know, it's where I got onto it. I wrote it right through to Medicare age at age 65. Wonderful coverage, wonderful programs. They manage risk, it's not insurance. But the largest one, if it was an insurance company, it'd be one of the top 10 insurance companies in the country. So that spreads out risk among a lot of members. Also, the largest one recently added some wellness benefits too. Okay, I talked about small group health insurance plans. If you have gone out on your own and you have another employee, full-time employee, W-2, then you can set up a group health plan. The other employee can't be a spouse or a relative unless that person has a different last name. However, the cost will be lower than a plan through the Affordable Care Act if you don't qualify for premium tax credit. And in 2 months, November, December, you can submit paperwork and you can be the only one on the plan if the other employee, which has to be documented, through a payroll report, if the other employee does not signs a declination of coverage. In other words, an enrollment form that says, "Hey, I'm not signing up for this." So you could have a one-man employee plan with a better network, lower cost than Affordable Care Act plan if you don't qualify for premium tax credit. Good option for people that are going off on their own, franchise, what have you. Okay, Medicaid. And this is something most brokers don't want to talk about because it doesn't put money in their pocket. But this is something that's important that you understand. CHIP. Who's heard of CHIP? You may not have, but it is a fabulous program. It is designed to help primarily children under the age of 19. It's income-based, okay? You have CHIP, very affordable. I think the most it would cost if you qualify based on income, you could have 10 kids on CHIP, or, I had 3 siblings, but you know what I'm saying, it costs the same amount no matter how many kids you have. It's like $60 or $50 or no cost depending upon your income. Pregnant mothers are eligible for Medicaid in Texas based on household income. And then adults age 65 plus are eligible for Medicaid in Texas, and some full or partial Medicaid plans that are based on income, and federal programs based on income and assets that will reduce the cost of Medicare coverage. Okay, so you have to requalify for CHIP, or if you're a pregnant mother every 6 months, or as an adult age 65 every 6 months, you have to requalify. Now, for adults age 65 plus, there is the potential, a very high potential, that there could be a clawback of benefits that you receive in the event of an increase in household income or assets to your estate. Oftentimes, people will have life insurance, but their income poor. Well, the state of Texas can claw back what benefits you received under Medicaid, but it's a great program. It is a lifeline for the most frail people in the state, and it's a good plan. It is a state program. Benefits are subject to state laws and regulations and budgets. However, there are also federal programs based on income for individuals that are age 65 that can reduce the cost of prescription drug plans. For more information about this, here are the 2 if you fall in these ranges, you want to go to yourtexasbenefits.com or texaschildrenshealthplan.org for more information. All right, here you can see who's eligible. Medicaid, again, based on family income. Okay, here's who's eligible for, and then the same for adults. I'll leave that up for a second. And just jot down the numbers based on your family size. And these are 2020 numbers. They will be adjusted a little bit for 2021. They're just not out yet. Okay, CHIP. How much does CHIP cost? If you have, let's say you are a grandparent and have custody. I've run into this a lot. A grandparent having custody of a grandchild, or an adult with a child. CHIP is relatively inexpensive, and this is based on family size. Here's your monthly income. Here's how much you will pay regardless of the number of people on the number of children on CHIP. As you can see, it's very low. That's the lowest thing going. Good coverage. The network is good. These are HMO plans, which means you will have to get referrals to see doctors that are in network. There are also some dental benefits, good coverage, and very affordable. Okay, now, yes.
So Mike, pardon me, but so you can make $7,000 a
your
month and
family's
still
big
be
enough.
on that?
Now, again, that's a family of
Holy
8,
smokes. Wow.
And
Okay.
that's
Right.
a lot of Pampers
Okay.
and groceries.
Thanks.
Family that size. Okay, Medicare, who's eligible. And just so you know, here's where I'm kind of walking the line for compliance reasons. The minute I can answer questions, but the minute I start talking much beyond this, it then becomes an educational event. And if I talk about plan specifics like United Healthcare versus Humana or Aetna or somebody, then I'm really jumping over the line. So I can't really talk about this in detail, okay? Or I'm non-compliant. I like to stay compliant. I like to eat. Who's eligible? Individuals age 65 plus, or individuals who have been on Social Security disability income for 2 years. At the 24th month of Social Security disability income, they will say you'll get a welcome to Medicare and a letter and a card in the mail, and you'll be enrolled in a Medicare Advantage plan. The cost for Part B will come out of your Social Security disability income check, and the coverage is very good. You can apply for Medicare if you're not on SSDI. You can apply for Medicare Part A, and you want to do this. If you're approaching age 65, but even if you're on employer plan, you want to sign up for Part A. You always want to do this because your employer's plan, once you're 65, it coordinates with Medicare. And if you don't sign up for Medicare Part A, guess who pays that 20% if your company has more than 20 employees? You do. And that happens a lot. Certain health insurance companies, they know to check that, so they're going to be watching to make sure that you provide proof that you have Part A. Now, Part A is what your payroll taxes, accumulated payroll taxes. Most people, by the time you've worked 10 years, 40 quarters, you've qualified for Medicare, unless you have not, or then you can buy into Medicare Part A. Okay, and that often happens for people that are expats from another country. They maybe work 5 or 6 years, then they can find out how much they'll end up paying, and it'll be more than U.S. citizens who have been paying payroll taxes for 10 years. Part B, 2020. Again, 2021 rates haven't been released. Part B this year costs $144.60 for most people. $144.60. Part A you've already paid for. That covers 80% of your medical expenses. But that other 20% is what will financially break you. You can sign up for Part A and then get a Part D prescription drug plan, but then you're only, you're leaving yourself really at risk. If you don't sign up for Part B, either you have first of all, you have a 7-month window, 3 months before your birthday month of turning 65 or 3 months after, or within 2 months of leaving an employer's plan. Then you are going to be subject to a late enrollment penalty and also a late enrollment period for coverage beginning July of the following month. So you do want to sign up for Part B as a boy. Either if you're leaving an employer's plan or if you're turning 65. Once you have your Medicare card with Part A and Part B on it, then you can enroll in additional coverage that will cover that additional gap of 20% and provide you with other benefits, including drug coverage. Medicare is a super deal. Just, don't worry about the specifics, but for under $300 a month, you have unlimited access to doctors or hospitals. This year in 2020, your only out-of-pocket medical expense risk is under $200. It may go up a few dollars next year. Plus whatever your copays are for your medications, which you'd have copays anyways. Or for $144.60 a month, you could sign up for a Medicare Advantage plan, but then you have out-of-pocket maximum expense risk every year of anywhere between $3,400 to $12,000 per year, plus your prescription out-of-pocket expenses. So, it's a matter of, do you want to pay less and know that you have a set amount you're going to pay and reduce your risk, or do you want to take the risk at age 65 plus of paying less and taking on this risk, medical expense risk? Now, there is, I said $144.60 a month for Part B. Okay, 2 months within 2 months of the Affordable Care Act being approved, and there was over $600 billion with a B rated from the Medicare Trust Fund to pay for the Affordable Care Act costs. Congress realized that Medicare was about to go broke, so they, as a result, they instituted what is called IRMAA. Don't ask me to spell it out. It's just known as IRMA. It's a wealth tax. It impacts any individual who has a 2-year average income of $85,000 or a couple $170,000, and it's indexed. So the more you make, the more you pay. Withdrawal from retirement funds, bonuses, sale of real estate, it can cause you to be assessed IRMA penalties. You have one initial enrollment period when you first turn 65, or if you've been on an employer plan past that, to enroll in a affordable into Medicare. And this initial opportunity will you don't have to answer health questions. Okay, so the reason why that's important is Medicare supplement plan. Outside of that initial enrollment, either if you the first time you leave an employer plan or when turning 65, you don't have to answer health questions. After that, even if you've enrolled in a Medicare supplement plan, if you want to change your plan, or if you didn't sign up in addition, you have to answer medical questions, and the application will be underwritten, and you may be rejected. I had a client rejected this week because of health conditions that popped up at age 67. This is important because you may go back onto employer plan once you're on Medicare. So if you sign up for a Medicare supplement plan and then go back onto an employer plan, then when you go off of that employer plan 3 or 4 years down the road, well, in the meantime, you may have had a medical issue And if you didn't sign up for Medicare supplement plan when you first turned 65, then you won't have the opportunity to get that type of coverage. The option will be a Medicare Advantage plan that will leave you more out-of-pocket medical expense risk. That's a short, I could spend 3 hours boring you to death on Medicare. But one last point on Medicare. COBRA is not creditable coverage at age 65. What that means is if you are age 65, you must enroll in Medicare Part B within 6 months of leaving your employer, or you'll be subject to a late enrollment fine and period. So if you sign up for and a lot of times this is missed by HR departments. I hate to tell you, I run into this, about twice a month, it seems like. Somebody age 67 or 72 or something didn't realize they've been on COBRA for 18 months. Guess what? They're going to pay in a late enrollment penalty, and they can't sign up for coverage until the following July effective date. So that's saying the same thing there. I'm not going to talk about Social Security, but be cautious of Social Security, of collecting it early for a lot of reasons, but one of which is because of this IRMA. If taking Social Security puts you in the IRMA bracket, then you may not want to do that because the cost of your Medicare will go up as well as your taxes. Okay? So what do you choose? COBRA, Affordable Care Act / Obamacare, CHIP, Medicaid, short-term health insurance, Christian healthcare sharing ministry, small group health plan, Medicare, student health plans. Does your head hurt at this point? You can do it yourself. Not a good idea. If you go online for quotes, you have just become a lead, and your contact information will be sold and distributed to potentially and redistributed to potentially hundreds of agents at call centers all across the country that know nothing about you or Texas and will be selling cars next week. So be careful what you do online for health insurance. You could also, and that I'm going to talk about something you can do in a second here. You can also sign up for COBRA and write a big check every month for everybody in your family, or you can unbundle your health insurance so that you're paying for the best type of coverage for those people that really need it. Or you can sign everybody up for something, and then you have people that need more coverage or less coverage. Or worse yet, if you do it yourself, you're going to get bored or distracted. You get involved in your job search and you miss your deadlines, or worst thing that could happen in a pandemic is you end up in no enrollment. So I'm just cautioning you. The best use of your time right now is what? Focus on your job search, right? Don't try to learn what takes me 500 hours a year and 10,000 hours of my life. You can, but I'm just letting you consider, return on time invested. Considerations: who's healthy and who's not. Household income, age, the length of your job search, the likelihood of a W-2 job versus being a 1099 gig worker, your budget, available liquidity, and every year that you pull from retirement funds is that much money less that could be invested and used for when you're unable to work. So be careful of using retirement plans unless it's going to save you, like the example I gave you. If it saves you or gives you the opportunity to get in a bracket where you're eligible for a premium tax credit. Okay, you have dates. There's a lot of stress about this. There's enough stress in 2020. Too much stress. Know your implementation dates. So you can decide now for each family member. Just like Mark mentioned, we talked back, Mark, in July or something? Well, you don't have to do anything till July or till November, but at least you knew what to do. at that point, and it saved you from having to worry about it. You went on to, to live your life and do other things and conduct a job search or, enjoy life. Um,
Yeah, it actually took the whole stress out of the experience because this is not my subject, and Mike just was pretty straight, and I'm looking forward to just having perhaps another 10-minute conversation with him,
yeah,
and
the
then I'm
rates are the
just sign
rates,
up for
but
what he's
knowing what to
telling me
do,
to
what
do.
the best options are, and what's going to be the most cost-effective coverage for the coverage you need based on your health is something that could take hours. And, if another government subsidy comes along, you have to think about that. But doing this now and at least making decisions takes some of the excess stress out of your life, and then you can implement it whenever you feel like it. And, you can talk to your spouse about it too, if you're married. 5-minute phone call. Uh, like I said, nothing is good except by comparison. You may be so used to employer-based health insurance, but you're not looking for it. You're not an employee anymore. So you have to look at what is available and know what the options are, and then make a decision based on the best option for your situation. And like I said, 5 minutes, I'll ask questions, send you some emails. This time of year, like I said, 90% of my business is from October 15th to December 15th. So, I can't do I can't do email tags, but texts or calls, I'm usually very, very responsive to phone calls, and may not get back to you on a phone call till later in the afternoon or early evening, but I will get back to you. So what can you do now? You can try to estimate your modified adjusted gross income now, or again, I help people, so I'll ask you questions. I'll get that. And again, it's 2021, 2020 doesn't matter. If your Magi estimate is too lost due to job loss, then we'll talk about withdrawals from retirement accounts could save you thousands of dollars by getting you in a bracket where you're eligible for a tax credit. I'm actually very close. I'm waiting for compliance approval of a new website that has been hacked, was hacked, and I'm in the process of rebuilding a better website right now. And it's in the final stages of compliance. Should be approved by the end of this week, but I'm not in control of that. Affordable Care Act plans have a shotgun start, and rate and plan designs won't be available until November 1st. But you can look at 2020 plans, okay? So you can look at 2020 plans to get an idea of what's available. Talked about unbundling you. I will send you information on other options, and I'm not going to spam you, okay? I have learned not to be a pushy. Nobody likes a pushy salesperson. That reminds people too much of aluminum siding or car sales types. That's not some people. A lot of people do that in this business, but that's just not the way I was built. MedicalInsuranceExchange.com will be live as soon as it gets through approval. This is a safe place where you can do some homework on all these different options, okay? And you don't have to worry about your information being sold to as a lead to thousands of brokers. You can look at short-term plans for one member or two members or three members, or I'll do it for you if you call. But if you feel funny about calling, you can go on there and do some homework on 2020 plans, knowing they'll be kind of like the 2021 plans to get an idea. Fiddle with income levels, do what ifs. If I make this much next year, you can see what your tax credit is. So it's not so much, you see these websites that are, they're like Amazon. It's totally impersonal. You just get a quote and enroll, not knowing what you're enrolling in. That doesn't work. Okay, health insurance, it's so much more complex, and you're going to overspend or underspend or have too much risk or not enough risk. So this is a way, though, that you can get familiar and comfortable with all these different options. One site, compliant, secure, to be able to do some of this stuff. And there will be more. I'm also going to start live streaming tonight, every Mondays from 5 to 6 p.m. on Facebook and hopefully LinkedIn and YouTube. LinkedIn is a hopeful because they have to prove it. But if you connect with me on LinkedIn or Facebook, you'll see it go live. Also YouTube. And it'll be Ask Me Anything. I'll have a little bit to cover in a compliant way, but it's primarily to answer questions in general, so that, for people that may have listened to this but aren't sure in certain things, or people that weren't able to attend, they have a way to get some input from a guy who has been doing it, who really studies it. Typical proposals include min-max household income estimates for next year, looking at research across, imagine looking at, if you have 5 doctors and you've got 6 or 7 insurance companies to see if they're in network or not, you can chew up a day. Provide enrollment deadlines and coverage effective dates for each option. Talk about advantages, disadvantages. You can, in terms of conversations, we can do that on a Zoom. I have to stay a hermit right now, but so you can't enroll through Zoom, but I can certainly help answer questions and we can have a discussion. One more thing. In a pandemic, and I know this personally because my job search after 2001, after about 2+ years of looking for a corporate job, that wasn't going to happen. Okay, so I went out on my own. I couldn't wait any longer. I had a family to feed, and I decided it was a chance to jump off and do something new, and I'm glad I did. I'm very happy. I love what I'm doing. It's it's geeky. Not too many people want to do what I do. I guess that's fortunate, but you can find your passion and find happiness and more security that you have, especially as you get older, being on your own versus working for the man. So consider alternate careers and consider where best to use your time. And I would suggest to you, not trying to be the expert in the stuff, but you're an expert in something. Everybody's an expert in something. And put your time into that. Let's see what else I got here. Thank you. Thanks very much. I love doing this. It's a great time to connect with people and see old friends. See how much hair Foster's lost. Right? He's gone. But anyways, I appreciate your time, and I'll take questions. I have to. I've got 20 minutes here, but if there's no questions, you can reach me tonight. But I'm all yours.
There's a couple questions, Mike, in the chat. One is, any advice on what to do about extending COBRA coverage into 2021?
Good question.
COBRA
There's
is
2
limited
things.
for
If
how
your
long?
company has 20 or fewer, fewer than 20 employees, there is no COBRA. There's what's called state continuation, Texas state continuation, and that's for 9 months for companies domiciled in Texas. For companies 20 and up, you have COBRA continuation of 18 months unless there's been a divorce or death, in which case it can be extended. And that's from a loss of coverage.
Okay. Okay. Oh, one person commented your email address at the bottom of the slide may be
that's
incorrect.
awful.
Maybe missing an R in group.
Thank you. I had surgery on my left hand, so I'm going to blame it on that. I just have to hunt and peck. But yeah, that is wrong. It's Chapman and Denver Group. Thank you for that.
And someone is asking if you'll be sharing your slides with us.
I'm going to share live streaming, and I will have a recording that I'll put up on, I don't know, probably YouTube or on the Google Drive, so anybody wants to watch this. And I'd recommend, just do what I do, watch it at 3 times the speed, and pick out the parts that are meaningful and relevant to you.
All right. And someone else asked, okay, is
Um,
out of the two
well,
phone
good
numbers you
question.
list, is
Actually,
one better than the other?
They're both good. They both accept texts. And my office line will roll from my cell phone when I'm out of the office, which these days is most of the time due to social distancing. So, you can reach me. You can reach me till about 8 o'clock at night. After that, it's tough. And weekend afternoons. And as we get into open enrollment, it's pretty much longer than that.
Okay. And another person asked, I have sons on disability. Isn't there
From,
something offered to help me
Okay,
provide for
for
them? Not many can afford coverage.
for
Go
Social
ahead.
Security disability income, 24 months, then they're eligible for Medicare. Now, if you're asking for financial assistance, I'm going to give you a couple of references. The first is yourtexasbenefits.com. And the second one, I'm having a little brain fart, but there is a good site for, I'll find it. I'll mention it on the live stream tonight. And if the person wants to send me a text, I'll think of it probably the minute we're off.
Another question is, can you sign up for COBRA and
No,
not
you have
pay until
60
the
days to
pandemic is
sign up for
considered over
COBRA,
by the
and
government?
that's one way. Here's the thing about COBRA, good and bad. If you need COBRA, if you have a serious, potentially life-threatening or chronic or expensive condition, you can wait 60 days to sign up for COBRA, but you have to pay back to when termination ends. So that's a big check you have to write for those 60 days and possibly the next month. So you may have as an individual, it may be a $2,000 check for COBRA. So, but now that we're out of as far as I know, we are in Texas, and except for maybe some of the coastal areas, we are out of the federal emergency period that ended the end of September. So there is that was that way earlier, but as my understanding is, it's 60 days. And if the federal emergency is extended, I haven't heard about it.
No, we just got cut off yesterday.
Not on the insurance, but I like the
That
thank you
is
note.
a
How did
slide
you create that one?
that I subscribe to a couple of services, and I think that was one of the template, one of the images. I don't know if it was photo stock or something like that I used. So. Uh-huh.
Mike, we have one other question is, someone is asking you to give
Okay,
the deadlines again,
for
open enrollment
Medicare.
for 2021.
Open enrollment, the first day you can enroll is December 15th. Medicare open enrollment ends December 7th. For the plans through the Affordable Care Act, the first day of open enrollment is November 1st. And generally, you were not going to be able to see anything until November 1st. But you can use the medicalinsuranceexchange.com beginning next week to at least start doing some homework once the site is up and available, been compliance approved. Open enrollment for the Affordable Care Act goes from November 1st through December 15th. And in previous years, it's been extended. I don't think it'll be extended this year, unless something disastrous happens, except for in in the event of an emergency, coastal flooding, hurricane, tornado, you name
And one other question is, can you use
Actually,
your
you
health
can't.
savings account to
Uh,
pay for COBRA?
it. You can use, that's the one exception that you can use your health savings account funds to pay for COBRA premiums as well as long-term care insurance premiums if you have a long-term care insurance policy. Other than that, it cannot be used for uh, paying premiums.
Okay, I think that is the final question that we have, Mike. I appreciate your time and your willingness to share the slides and share the recording with us later today. I think, and once again, I will just give my own endorsement to Mike. When I was in job search, Mike helped me and my wife out with kind of going through and figuring out what insurance or exchange or Christian ministry would work best for us, and was very helpful, and it saved me a ton of money. And so I would encourage you to reach out to Mike and utilize his services. Once again, it's no charge. So it's one of those things where you're going to get good information, and you don't have to worry about somebody trying to take advantage of you on the back end. So he does great work. So
Hey,
once
thank you.
again, Mike,
It's been a
thank you
pleasure.
very much for your time today.